said I'll press live exactly at 7. I'll send a go once I see it's on our social media. So. And somewhere it's chiming 7 o'clock.
Yeah. I thought that was the backdrop for that.
That would be me.
Oh, okay.
Okay, welcome everyone. My name is Philip Kane from Thunder Mist Health Center, and we are so glad you've joined us for our HIV care and treatment update in the face of COVID-19. I want to introduce you to Doug Ducharme, who is a case manager at AIDS Care Ocean State, also served as a peer support advocate with AIDS Care as well. Doug is going to serve as our facilitator for the evening program. So I'm going to turn things over to Doug. Take it away, Doug.
Thank you, Philip. And good evening, everybody. Tonight we have 2 half-hour segments. In the first half hour, we'll be talking about clinical care and treatment. We have 4 presenters. So with no further ado, I'm going to introduce our first speaker, Dr. Sapna Chaudhry. She is a specialist in infectious disease and internal medicine at Thunder Mist Health Center of Woonsocket. Dr. Chaudhry, you have the mic.
Hi, everyone. I'm happy to be here. And, I'm surrounded by some experts, including, Dr. Garland. And so I'm sure he'll correct anything that I misspeak. I'm not exactly sure if I'm supposed to just speak or you're going to ask me some questions. What's going on? I can talk a little bit about what we do at Thunder Mist, if that is what you would like.
Sure.
Okay, so just a little bit about myself. I'm an infectious disease doctor by training, and this pandemic has certainly brought this very boring and very, academic specialty into the forefront. I wish we weren't, but we are, and so and we're happy to be of help. So at Thunder Mist, we have a multi-specialty community health center setting. And to facilitate care and to provide good care to our community, we did add, the ability to see sick patients during COVID. So if you drive by our Woonsocket or West Warwick locations, you'll see some tents in the parking lot, which are basically to keep the clinical area secure so that we can screen for illness and make sure that our patients coming within the building for care are served safely. And then outside, we are providing, at this point, both testing only as well as the ability to do urgent visits for walk-ins. And so so that's a little bit about what we do. So both our Woonsocket and West Warwick locations are able to do that. And in terms of my own, 2-minute thing about how the last few months have been for us. Obviously, they've been life-altering, but I'm proud to say that we've all stepped up, and with the ability to do visits over the phone and video visits, and the help of all of our teams, which I'm sure everyone will endorse, we have been able to make sure that our communities are served, and healthcare is not interrupted in any which way, and especially behavioral health and substance use treatment, which also is a big part of what we have continued to do. And I think our patients have not seen any interruptions in care. So that's a little introduction about where we are with the pandemic. So as Rhode Island continues to make us proud with, keeping our numbers down, and I think I have so much respect for both our governor and the Department of Health. And I feel proud to be surrounded by some really nationally and internationally recognized infectious disease doctors. And we've really done a great job controlling this pandemic and keeping the numbers down. And I'm hoping to keep it that way. So I'll stop talking at this point. And Doug, tell me what to do next, or tell us.
Okay. I should have mentioned in the beginning, each speaker will be given about 5 minutes to present, and you did a very nice job. Thank you very much. But I think, Philip, as we're going to be moving forward now. Okay. Our next speaker is Dr. Joseph Garland. He is the medical director at the Infectious Diseases and Immunology Center in Providence. Dr. Garland, you have the mic.
Thank you, Doug. We'll give you guys a little bit of an update of where we stand. So I echo Dr. Chowdhury's response to how things have been going in Rhode Island. It really has been a unique time to be an infectious diseases doctor, and it's been an incredible. We've seen incredible leadership, by the governor and the Department of Health, and I think that on the national stage, Rhode Island is doing better than almost any other state in terms of availability of testing, in terms of managing the numbers of coronavirus cases. One of the roles where both Dr. Chowdhury and I intersect with our training and what we do day to day is with the coronavirus outbreak being a major infectious disease, and then with our roles providing HIV care in the community. I think that we end up getting a lot of questions just on what is the effect on people living with HIV and COVID. So I think that she and I will probably try to talk a little bit about that at the end if there are questions on that. To talk briefly about the Immunology Center, I think many folks are familiar with it. We are a large infectious disease clinic, an HIV primary care center located in Providence, attached to the Miriam Hospital. We serve about 1,800 people living with HIV. Just before the pandemic started, we moved from our office on North Main Street into a beautiful new space on 180 Corliss Street. We moved in on February 20th, and the first case of COVID was diagnosed in Rhode Island on March 2nd. So we literally had just arrived when everything changed. Some of the specific response that we've had in the office was to switching very quickly to telemedicine visits. So around March 15th, which is when I think the 20th case was diagnosed in Rhode Island, we had switched almost entirely to telephone visits for patients. We have since, in the last few weeks, switched back to having a number of patient visits in the clinic. We were lucky that we moved into the bigger space because we have additional exam rooms, so patients aren't waiting in the waiting room. They can come in and pretty much very quickly are put in their own room. All the staff is masked. All the patients are pre-screened. I think that's the same at Thunder Mist and the other health centers, that we've really thought carefully about how to protect our patients when they come into the office. In general, when I talk to patients, they're happy to come in. They want to see their doctor. They want to get a checkup. It's hard to get everything out on the phone and feel like you had a full visit. And so we are offering patients sort of a balance between, if they don't need labs, they don't need anything examined, and they'd like to do a telephone visit, we're still happy to do those, or audiovisual visit. But patients who need to come in for any medical reason, we're making sure that they're safe when they do. A couple of specific things that have come up, as a Ryan White Center, meaning that we get federal funding, just like Thunder Mist, to provide care for people regardless of insurance status or ability to pay. We know that we care for a lot of people who've been adversely affected by the pandemic. So we talk to patients about what their major struggles were. One early on was actually getting quality masks. So we purchased 500 masks and have been giving them out to patients. They're cloth masks. They're washable. They're made by a local company. So any of our patients can stop by and pick up masks so that they'll have a high quality mask to wear out in the community. And another thing that we ended up setting up was a lot of patients had a change in their job status, their income, et cetera. So we ended up putting together a food assistance program with Stop and Shop gift cards. So patients who are financially eligible we can offer. It's not a lot of money. You're not going to be able to buy out the store, but some Stop and Shop gift cards for people who are struggling, because this is an unprecedented time economically, as well as from a pandemic standpoint. Some of the other things that we've done, any patients who are coming on public transportation and are uncomfortable with that, we have tried to set up MTM or taxi cab service so that patients can feel safe coming into the office. And we've done a lot of phone outreach with patients. So if anybody listening is our patient, you've probably already been contacted by one of our nurses or outreach workers. And if you haven't, please call us and tell us what's going on and what you need. This pandemic is gonna last a lot longer than we want it to, certainly. And so one of the things we are still learning as things go is as the situation changes, as new struggles appear for our patients and in our community, we want to be responsive. So we really do want to hear from people about what's bothering them and what are the struggles that they're facing, so that we can try to help address them. One of the unique things about both Thundermist and our center is we offer a lot more than your average doctor's office. We really try to serve a role as resources for our patients, not just around health, but sort of what doctors call the social determinants of health. And I will take 1 minute just to say that, a lot of my patients, one of the most common questions for my patients to me is, what does my HIV status have to do with coronavirus? Am I at higher risk? Am I immunocompromised, et cetera? And Dr. Chowdhury has been doing this longer than I have, so I will defer to her on her speech. But my general conversation with patients is that if HIV were a huge risk factor for people getting COVID or dying of COVID, we would know by now. So it's very reassuring that we sort of still say we're not quite sure, because if it were a huge risk factor, it would have come out early. So I think that is already an indication that HIV is probably not a huge risk factor for COVID. And the data seem to suggest that there's some data from South Africa suggesting that maybe people with HIV might have a slightly higher risk of getting the disease, but there's conflicting data from other parts of the world where that did not seem to be true. So what I say to most of my patients is, as far as we can tell, HIV does not seem to be a major risk factor. And people with HIV who get COVID seem to have the same sort of spread of disease as everybody else. If it is reassuring, I'll give you some local data, which is that of our 1,840 patients in the clinic, we've had 28 patients diagnosed with COVID. None of our patients who were diagnosed with COVID died of COVID. We had only one patient die at all, and the patient was in a nursing home setting on hospice, and was diagnosed with COVID in that setting. So their death was unrelated to COVID. And all of our patients were on antiretrovirals. About nine of the 28 were hospitalized. So several of them ended up in the hospital, but all of them recovered. So it is reassuring, even on the small scale of our clinic, to see the range of disease was similar to what you see out in the world, and it's not something majorly different for people living with HIV versus people who don't live with HIV. So all of the same recommendations about mask wearing, washing your hands, social distancing is exactly what I emphasize with my patients. But I can reassure people, at least, that we don't have. I'm not worried that their, quote, immunocompromised is putting them at any particular higher risk. So I think I'll stop there. That's a little bit about what we do and a little bit about some of the background on HIV and COVID. And Dr. Chowdhury should chime in and correct me if I've said anything incorrect about the infectious diseases portion.
Okay, thank you, Dr. Garland. Some excellent points. And that was actually a question of mine, how the immune system for the HIV compromised person would be handling COVID. So thank you for that information. Moving along, our next speaker, Philip Kane. And Philip Kane currently is the Ryan White Program Manager at Thundermist Health Center of Woonsocket. Philip, you have the mic.
Thanks, Doug. So Dr. Chowdhury covered some of the services and what's happening at Thundermist. Just a couple of things that I'll focus on is our dental program. And, early on with basically the epidemic, unfortunately, our dental services pretty much shut down. We were just really seeing just emergency cases. So actually, starting June 8th, our dental offices were back up and running, but at a smaller or lower capacity. We've actually set up, because certain procedures done in our dental office present a greater risk for COVID transmission. One of the things we've ended up doing is we've set up specific teams at each one of our sites. So in Woonsocket, in West Warwick, and in Wakefield, the South County area. And the idea being, a dentist, hygienist, medical dental assistant, all of those individuals would work together as just one team, like Team A, Team B. And if by any chance a member of one of the team became infected, it wouldn't necessarily have placed the entire operation at risk. It would have only limited to that particular team. In doing that, some of the procedures take much longer. So again, fewer dental appointments than we had available. We actually do any emergency dental visits are actually done through telehealth. So basically the dentist is going to do an assessment initially of that particular individual, see what's going on for that particular person. Perhaps it's an infection, needs to first of all be treated with, antibiotic treatment. And then from that point, develop a treatment plan for the particular individual. I know that, one of the questions is, should I be seeing my dentist for my regular checkups? They've been, they were canceled over the last 3 months. And yes, we are encouraging our patients to start rescheduling. But again, just with the knowledge that it may take a little bit longer to get in. And also with these teams, they're working on particular days. So it's not like, Dr. Smith is going to be available 5 days a week. Dr. Smith may only be seeing patients on 2 or 3 days a week. On maybe the little bad news side is that although all 3 of the dental offices at the health centers are up and operating, our location in Providence is not operating as yet. And perhaps it may be until September before the Providence site reopens. In the meantime, the 2 dentists who have worked at the Providence site, Dr. Murphy and Dr. Bolus, their kind of full-time position is in our West Warwick site. So any of our Providence dental patients would be able to set up an appointment, to see whoever their dentist was, Dr. Murphy or Dr. Bolus, they could see them at the West Warwick site. I think actually, and then just to mention that, obviously we're still doing telehealth, but we're starting to see more patients in person. So depending upon the needs of the particular individual, Dr. Chowdhury and Dr. Kavanaugh, who see our HIV patients, can certainly see patients in person and face-to-face. And our convenient care, which is our version of an urgent care, that is up and running and available. And, if patients, are experiencing, non-emergency room related type issues, they can definitely be seen in person in our convenient care setting. So I think those were the particular points I wanted to bring up. So I'll turn it back to Doug.
Okay. Thank you very much, Philip. Certainly last but not least in this half-hour segment is Garlette Parker. Garlette is the current administrator of program management at EOHHS, HIV Provision of Care and Special Populations Unit. Garlette?
Thank you, Doug. Thank
Welcome.
you. Glad to be here. Thank you. And so I wanted to talk a little bit about the Ryan White program, Part B, the AIDS Drug Assistance Program. And we're housed in the Executive Office of Health and Human Services. And so one of our main focuses with the surge of COVID is making sure that individuals were having the ability to pick up their medications, antiretrovirals, or anything surrounding their HIV care and treatment. And so we wanted to make sure we streamline those processes for clients amidst this pandemic. So one of the things we did see early on with the pandemic is a rise in ADAP applications. And so in some cases or another, they were recertifications, but we had a significant amount of increases. And so that could be related to several different situations, of course, if the person was out of care or the person moved back into state. But we did overall see about 50 clients that re-enrolled or were reactivated from March up until present, and some of that is in relationship to COVID-19. One of the things that Luba, who is our ADAP coordinator, found is that we had an awful lot of clients, this is before us teleworking, coming into the office or calling to make sure that they had the ability to pick up their medications early. And so we, toggled between having the 90-day medications filled for early refills. And so most of the clients were successful. They received approval from either the ADAP program or their doctor to receive these early refills, especially when it came to their antiretrovirals. We also have the Rhode Island Federally Assisted Benefit Program, which I loosely call RIFAB. And so in a lot of ways, that's related to the ADAP, because if an individual is uninsured or underinsured, that would, pose a barrier to them obtaining their medications. And so we did also see a spike in our RIFAB applications, and we've seen about 30 of those. However, some of those clients were able to stay on Medicaid. Some of them were already on Medicaid. They were due to come off of Medicaid, but because Medicaid extended that time frame for individuals to still, be eligible, it worked out perfectly fine for them. We also wanted to make sure about communication. So we wanted to make sure that our clients had the ability to communicate with us. And due to the fact that we are a little short-staffed at this time, we wanted to make sure those processes were streamlined for them. So our ADAP coordinator, Luba, she has a state phone, and so she's able to make sure that communication is not interrupted for clients to call for ADAP, or if they're having any situations with the pharmacy, etc. So we've maintained that. And then, of course, most of our clients, I would say probably about 85% go through the case manager. And so they either email her or the client themselves email her. And so moving forward with that, we have the ability to make sure that those processes are still in place. One of the barriers early on during COVID, our agencies expressed the need to be able to sign for the clients. The eligibility forms, typically we would have the person sign. And so we did make a lot of provisions in that sense. So instead, the case managers were doing attestations for the client, signing those, and that was perfectly fine with us. HRSA approved of that as well. And we also made sure that if an individual was unable to go to the office or communicate with us, that we would not terminate them. So we did extend out the redetermination process, and so that was extended out for 2 weeks. Moving forward, because we understand, we've talked to some agencies, they're not going to be reopening fully for a great deal of time. So a lot of these measures, as far as the case manager attestation and the redeterminations, we're going to keep those protocols in place right now as we move through the COVID process. And hopefully we can get back to the norm at one point or another, but we're just kind of basically playing it by ear. We have hired a new RIFAB person on HSRI's end, who is assisting us along with these insurance enrollments. She actually starts tomorrow. And other than that, that's basically where we're headed with ADAP. I think that's it. Do I have
Okay.
any questions? Yeah.
All right. From this point on, we're going to open up the conversation to guests, and if they have any questions, feel free to chime in. Anybody out there?
Doug, it looks like there's a question. There are a couple of questions on the board, so I can maybe I'll just read the one. The first one says, should people with HIV be getting routine preventive dental care right now, or should folks wait? I'm going to defer that one to Dr. Chowdhury and Phil because they run the dental program.
Sure.
I think Philip said a couple of words about this already, and in general, I feel like, just to tag on to what you said before, Joe, like we obviously have a smaller, patient caseload than yours, but by going 100% telemedicine, and by really, because the safest thing for anyone to recover from COVID is to not get COVID. And so ultimately, we've only had one person who gets seriously ill and fortunately recovered. And so even though I totally agree with you on the fact that I don't think there's any data to really say that someone with HIV is at higher risk, but certainly considering that more than half the HIV positive population in the US is now over 50, plus may have many of the comorbid conditions like diabetes and kidney disease and other conditions that predispose them for having a worse outcome. So ultimately, I feel like you follow the guidelines that the governor or the state puts out. But if you're out there and it seems like there's too many people, or people are not appropriately masked, stay home. So as far as going to your medical visits goes, with universal masking and universal symptom screening at clinics, you can be fairly confident that you're not going to get the infection within that premise. If you were to get exposed, it's probably going to be in a social setting. And so with that, I think the next question comes up, which is about connecting with new sexual partners during the pandemic. And so I wonder how you feel about that, Joe. That's a tricky one.
That is a tricky.
We want people to be happy, and human beings need to connect to be happy and to thrive. But I wonder if this is a good time to meet someone new. What do you think?
I agree with you. It's a really hard one. And I saw that question. I was thinking, how do I answer that? There is no good answer. And I think that's why both Dr. Chowdhury and I are struggling with that. The reality is this pandemic will go on for quite a while, and we need to figure out ways to live our lives as safely as possible. But it may not be realistic for people to say, I'm not going to meet anybody for a year. How to go about it the safest way as possible, I would say, is think about yourself and your risk factors and what you can do to try to reduce your risk of being exposed. And so if you are wearing a mask regularly, if you're washing your hands regularly, if you are limiting social contact, you are making yourself a lower risk person for carrying COVID, getting it, having symptoms or not having symptoms, but you're making yourself a lower risk person to transmit to other individuals. In terms of meeting somebody and connecting for sexual partners, it makes it difficult because people can transmit when they don't have any symptoms. So certainly if someone is sick and they're having symptoms, I would say maybe now's not the best time for us to meet up. But that unfortunately isn't a guarantee. People who have no symptoms can still have COVID and can still transmit. So there is no right answer here. I think as much as you can get to know a little bit about the situation of your partner, understanding the risks that they may or may not have from exposure, et cetera. And then from there moving forward with sort of decision making. But there is, unfortunately, at this moment, no magic way to be reassured that someone doesn't have coronavirus infection and can't transmit to you. I know that's a depressing thought, but that's unfortunately the medical truth. Sapna, did you have anything to add to that?
I agree. I'm thinking about all the things that I could say, and I think you kind of said them all, because I mean, yes, it's true that it's mostly like a droplet transmission, but then we don't know about other body fluids at this point, so we can't say, right? I mean, even though this is a respiratory infection, and one is but I think I overall agree with being cautious, and kind of maybe taking a little bit of time to figure it out. And if people take precautions themselves and are confident that their partner is taking precautions as well, and then there may be some shared decision making there.
Okay, we have reached our 30-minute mark. Thank you, everybody, for your participation in this part. Garlette Parker, Philip Kane, Dr. Chaudhry, and Dr. Garland. Thank you all very much.
Thank you so much.
Three out of four here. Okay. So good evening, everybody. Next up, we have, this segment is in reference to HIV support services. Again, folks, we're trying to keep each of our presenters to about 5 minutes of conversation and presentation. And then at the end of this half-hour segment, we will have some time to answer some questions. So to begin, I'm going to introduce my boss, Elena Woodley. She is the Director of Client Services at AIDS Care Ocean State. Good evening, Elena.
Hi, Doug. Nice to see you. All right. So for clients who have been with ACOS for a while, you know that we've been doing things a little bit differently in the past couple months. Lots of phone calls, lots of mailings, lots of emails. You know, for those of us engaged in our mental health stuff, having to learn Zoom, it's been quite the adventure, I think, for people, for both staff and clients. But we're excited to announce we have started reopening a little bit. And so with that, though, comes some changes, some new, some exciting. So I'm going to kind of go through what we offer and the changes, and how, if you either are currently a client or want to become a client, what that kind of looks like for you. So at ACOS, obviously our biggest service we offer is case management. So for those clients who receive case management from us, we've started kind of 3 new COVID-friendly options. So we have curbside appointments. So we have appointments available in our parking lot. So we literally have cones lined up. You just pull up, your case manager can come out, you guys can do whatever you need to do, paperwork, ADAP, EFAs, anything like that. And then we can send you guys on your way. We also have in-office, so we have designated spaces for our clients. So you guys, if you feel safe coming in and would prefer to have a face-to-face with your case manager, they're designated rooms. They're disinfected after every use. There's not a lot of items, so there's not a lot of stuff laying around to kind of spread anything. There's barriers between you and your case manager, all those sorts of stuff. Everyone's being asked to wear masks inside the building, so if that's an option for you as well. And then we have outdoor. So obviously outdoor right now, today wasn't a great example of that, but the weather's nicer in the summer. So we have lots of picnic tables and outdoor seating options for you guys. If you still kind of want that in person, but maybe being in an office makes you a little kind of squealy because of just COVID and everything that's going on. So those are kind of the 3 options. They're all appointment only though. So I know ACOS in the past has been very friendly to walk-ins, and that has worked very well for us in the past. But because of COVID, we're really asking that you guys call ahead. One, to make sure that we keep, you know, the number of people in the building to a minimum, and also to make sure the person you need is there. Maybe they're out at lunch or they had to run somewhere for another client. We really want to make sure that you can get what you need when you need it in a timely manner, so you're not waiting around or having to come back or leaving your house more than once if you don't need to. So again, those are all options for you. So curbside, in office, and outdoor. Appointment only, and please wear a mask. So that's for our case management. And then very similar for mental health. If you're engaged with any of our clinicians, We have all those options as well. Individual curbside might not be your best option if you need a one-on-one with your clinician, but we can make it work if you're if that's what you want to do. So again, just call your clinician ahead of time, see what works best for you guys. We still offer Zoom. We have individuals, we've got one-on-ones. All of our groups are still happening. So if you have been or are interested in the young adults, all men or all women's group, you are more than welcome to join. Those are actively, they've been going on, but we're continuing them, and then doing some outdoor Zoom combos that group members feel comfortable with. Next up is our prevention. So our needle exchange and testing. We are still doing both of those. We have a tent set up in our parking lot in Providence off Broad Street for HIV and Hep C testing. They are only doing the finger prick testing though, no oral swabs. And we're still doing needle exchange and home deliveries. So if you get any supplies from our Encore or needle exchange program, they are still actively supplying. And if you need it brought to your house for any reason, because you don't want to leave or can't leave, or whatever you need, just give us a call and we are happy to bring those supplies to you. Or if you need to come in again. We do encourage appointments for testing, but they are not required. And that's just, again, to make sure that you're not waiting around with a bunch of other people if you don't need to be. So, but if you're in the area and need to swing by, please do so. So those are kind of the big picture stuff at ACOS. So.
Okay, thank you so much, Elena. Good to see you again.
You too.
Moving on to our next presenter. Forgive me if I pronounce your name wrong. Mikkel Wadowitz. Mikkel is the director at AIDS Project Rhode Island. Sir, you have the mic.
Michael, I think you're on mute.
Yeah.
I was trying to be nice. It's actually Michael.
Michael,
so it's
okay.
just spelled funny. But
Thank you.
Good evening, everyone. Nice to see some familiar faces here. This is my first time doing this kind of setup, so I'm used to Zoom. I'm kind of trying to figure out where to look. But just to give everyone kind of an update where we're at with AIDS Project Rhode Island. Right now, I think the only service that we're not providing is congregate meals. So obviously having people together in one space for food is not something that we're doing, but all of our other services are up and running. And that includes telehealth appointments for mental health outpatient. Our case managers are interacting with clients via video, phone, and outdoors at a safe distance with masks when appropriate. We are not at the moment doing in-building appointments. A lot of our staff share space with other programs, various people that we have to organize. So that's going to be a longer term goal. But if you do need something from us, we are being very responsive via delivery, drop-offs, being able to get you anything that you need in terms of paperwork, setting up appointments. And I'll type in the comments when I'm done just a couple of contact numbers that you can use. Our food pantry and personal care item pantry is going strong. So if anyone who is living with HIV in Rhode Island needs groceries or personal care items or PPE, including masks, gloves, we can do drop off or delivery to you. Our staff has been doing that the entire time during COVID. And I think from February to now, we've seen about 155% increase in demand. So we're really working to meet that. And we know a lot of people need that help. So in June, we handed out 360 bags of groceries. So we are also making sure that people get linked to COVID testing if they need it. We are still doing HIV testing, but what we're doing is sending out at-home HIV tests. So we're not doing appointments in person at this time, but if anyone has the need for an HIV test, if you know anyone who wants one, they can fill out a form on our website, which is just aidsprojectri.org under Get Tested, and we can mail that out to them if they live in Rhode Island. In general, our services are, like I said, still going as as they have been. I mean, big shout out to all of our clients and everyone in the state really who does this work for really changing their delivery of services like in a flash overnight. And I know it's been a little frustrating for some of our clients to kind of figure out what they can and can't do. So we really appreciate their patience and everyone just working together. And I know we've all worked together. Everyone on this call has worked together to make sure that everyone's getting what they need. So if for any reason we're not able to provide a certain service to you, we'll make sure you can get it and refer you to the right people. But much like Elena said, and I'm sure as Michelle will say, between all of us, I think you should be pretty well covered. The last thing I was just going to say really quickly is that we are starting to do plan some client gatherings outside while we can, while the weather's nice, small groups, just to do some socializing, make sure that people feel a little more connected as human beings. And so if you're currently a client with us, we'll be in touch with you about that soon. Thank you.
Very nice. Thank you very much, Michael. Moving on to our next presenter, it is Michelle Taylor. She is currently the Director of Outpatient and HIV Services, and she's under the broader Community Care Alliance as well. Michelle, take it away.
Thank you, Doug. So what Michael and Elena said, ditto. I mean, we've really been trying to work really hard. You can hear my very large German Shepherd in the background, who's joining our conversation. But we've been working really hard to make sure that our client services are as uninterrupted as possible and while ensuring safety. So most of our services have shifted to phone-based care. We are beginning the reopening process, and by that we mean by appointment, sessions in the agency. We have continued to make sure that people are having access to food. So similar to what Michael said, we are making sure that we are distributing food on a weekly basis, giving people access to personals. We've had some clients with some serious health issues, cancer treatment, and that has continued uninterrupted. So our case managers have transported to appointments. We're, having them in the back with masks, sanitizing vehicles as much as possible, but making sure that people get to their appointments and that their care is uninterrupted. The wonderful thing about Community Care Alliance is because we are a combined behavioral health organization and a community action program, we have over 50 programs. And so we've been continuing to work with our clients to identify the full scope of their needs and make sure that if they have, if they have a need for mental health or addiction treatment, that we are still connecting them to those resources. So again, while we're doing a lot of things phone-based as much as possible, our intakes have not stopped. At Agape, we have both a Woonsocket location, and which is primarily outpatient case management, but we also have Agape Providence on Elmwood Ave in Providence, and that is serving men with HIV and co-occurring behavioral health needs. And we're very happy to say, I feel like I should knock on wood, but no one there has become positive. And we've been pretty restrictive with both staff and clients to make sure that, everyone is safe. So our staff are very cautious about adhering to all rules, even in their own personal lives, so that we're not bringing anything into the agency. So, and trying to do our best to make sure that people are, attending to their emotional needs, right? I'm sure we've all seen how isolating this has been for staff and clients, and really making sure that we're keeping people as busy, at home as possible. So helping them find ways to keep themselves from feeling as if they're all alone in the world. So those have been our priorities.
Okay. We were scheduled to also have one more presenter, Ashley Perry, who is the intervention case manager with Project Weber Renew, but she doesn't seem to be here at this time. Perhaps she might join us in the next few minutes. So going forward, yes.
It says in the comments that she's backstage and is not able to get in.
Oh, so. Okay.
So I'm not sure how we fix that.
let's bring Philip in. He might have some ideas for that. Philip Kane, are you still with us? Maybe not. Okay. Well, we can open it up now for questioning from our other guests. If any of you professionals would like to offer any more information, please feel free. Do we have any
I was just going
questions?
to say really quickly, there's a couple of comments that came
Sure.
up. I was not able to post in the live comments for some reason, but someone asked how someone gets grocery drop-offs, etc. Our food pantry coordinator is Kim, and her phone number is 401-744-4735, and people could contact her directly to get more information about that if they're interested. So I just wanted to make sure people had that.
I can also share if they're in the Woonsocket area, the phone number to call would be 401-235-6057.
And for ACOS, you can call 401-273-1888. And that number is our general number, so they can connect you kind of wherever you need to go.
Michelle. Oh, go ahead. I apologize.
No, I was just going to say really quickly, someone posted a comment asking if there were any buddy services or other kinds of friendly listening services right now. And I'll let Elena and Michelle chime in on this as well. We don't have a formal program at APRI at the moment. That's why we're trying to do some more informal, like small client picnic or gatherings, usually with case management clients. But we're going to be exploring that throughout the rest of the summer. So I'll let the other two chime in.
Sure.
Yeah, it's similar, ACOS. We do not have a formal buddy or friendly listening service. We obviously have our case managers and we do have our clinicians. So if you're looking to be in a group with other individuals with shared experiences, that's probably might be a good fit if you're interested. And again, that main number, that 273-1888, that can connect you to any of our behavioral health or group services if that's something you're interested in.
Similarly, Communicare Alliance Agape does not have a specific buddy program, but we are looking at, just as they are doing at APRI, some small group gatherings out in the community. But we do have what is called the Serenity Center, which is our peer-run recovery center. So for people who are identify as being in recovery from either substances or mental health issues, we do have peers who are available for support, and some of them have lived experience with HIV as well. So we are taking appointments for meeting with those folks. So if people have questions about that, they can call me at 401-808-4384.
And I just saw that Dennis asked for the number for food drop off, and I just, maybe people may have missed it, but I'm not able to post it yet in the live comments. I know they're working on it in the background, but again, it's 744-4735, area code 401, obviously. And there was another, sorry, I'm just seeing it. I'm just going to read all the comments that come in.
That's why I can't see them. Please do. Yep.
There was another one asking about online group or resource for clients to connect with each other virtually. We don't have a formal thing in place. Elena, maybe you do over at ACOS because of the support groups?
Yeah, so the groups do meet virtually or have been meeting virtually with the attempt to kind of start regrouping. So, you know, if you're interested in a group setting, we'd be happy to talk with you, but they're kind of through ACOS. So if it's something, if you know, a group setting was something you were interested in, we can absolutely kind of get you in and see what works for you, either virtually or in person.
And at the Serenity Center, we do have a Zoom recovery meeting that is held on Wednesdays at noon, and that is open statewide. So the good thing about Zoom is that we don't have to be limited by transportation or location. So, you know, and as we start to get more participants, just the question being asked, I'm thinking, oh, we can do this. So I think that we will certainly be exploring this option specifically for our Agape folks. So thank you.
Okay. Michelle, I have a question. I understand that you also provide counseling services for the substance abuse and treatment population.
Sure. So we have co-occurring integrated services. So we provide care for individuals with both mental health and addiction issues. So if people are interested, they can walk into or call our intake services at 800 Clinton Street in Woonsocket. The phone number there is 401-235-7121. But Monday through Friday from 8 a.m. to 2 p.m. we are doing assessments. Right now they've been doing much of it by phone. People are preferring that obviously for good reason. Then we have a very brief meeting to have people sign off on the intake paperwork that is required. And that is of course done with all of the appropriate COVID safety precautions.
Go ahead.
Oh, I was just going to say there was because I know it's a shame Ashley hasn't been able to get in, but Project Weber Renew also has a support group for HIV positive folks. I know they're also doing a little bit of in-person HIV and Hep C testing. So I don't know. Obviously, there are some people out there watching who are involved with Project Weber Renew. Probably Ashley is on there. I know Dennis as well. So if there's anything else that you all want to post in the live comments, just to make sure people know, please do.
I do want to add also that we do have a connection with ACOS. So we have one of our opioid center of excellence liaisons who's running around Woonsocket tirelessly to make sure that we get harm reduction supplies out to people, and that has she has continued doing that throughout this pandemic. So if people have that need, again, they can call me and I will connect them with her. So it's 401-808-4384.
Okay, very good. Are there any more questions? I apologize. I can't see anything coming in. I'm on a phone, unfortunately, so I'm not sure I have all the capabilities of the laptop. Are there any more questions?
I noticed something up top, which I'm going to just scroll back and answer. Someone asked about getting a COVID test and an HIV test at the same visit. And yes, that is possible. And yes, HIV testing is available at all Thundermist sites. And I'm sure most of the other people in the group must offer the same. I don't want to speak for anyone, but I don't know if anyone wants to chime in, but definitely all the Thundermist sites do offer HIV testing.
We have about 8 minutes in this half hour remaining. If any of our presenters would like to offer any more information, great time to do so.
This is Scarlett. I couldn't get into the live comments, but I wanted to provide that the website that Marianne Raimondo gave us for the age-friendly virtual community group. It was in the live comments about community groups or anything virtual. And I know she said they had like some meditation, but I'm unable to put it into the live comments there. So I put it into the private chat. So I'm wondering is there any way for anyone to go in on the back end and just put that in with the live comments for that site that Marianne provided us.
Okay. Any other comments?
There was one question about, and sorry I appeared to abandon you guys earlier, but I was going off to see if we had a limited number of people who would be on screen when we were trying to get Ashley on. But there was a question regarding concerns around possible shortages of HIV meds and PrEP meds. I don't know if Dr. Garland or Dr. Chowdhury wants to comment on that.
Sure. I apologize. My dogs are making noise in the background, so if you hear barking, that's them playing around. It certainly was a concern. I will say that it turned out not, but luckily for the vast majority of our patients, not to be an issue. We were able to work with pharmacies and insurance companies, and I think, and with the ADAP office, I think Garlett's office was really spectacular in figuring out ways for people to renew their ADAP, extend their ADAP, et cetera. But if that is happening to anybody, if people are running into issues getting their medications, guys, quiet. If anyone's running into issues getting their medications, to please call us. So call your case manager, call your doctor's office, because we have been dealing with this with other patients and have generally been able to actually figure it out. So please let us know. Don't struggle on your own. So people luckily have been very understanding.
And the other, the flip side of that would be like, is there any national shortage? And I think as of now, there's none identified in either PrEP meds or HIV meds. I know that some states, and with some medicines, of course, we've had no issues with early refills or 90-day supplies. That's usually been a struggle with HIV meds, getting those long-term, like 60, 90-day refills. I don't know, Joe, if you've had any luck getting that. I haven't.
No, similarly, because of the cost of the meds, insurance companies have generally not changed their policies on those. Although in unique situations with patients who we knew had to travel out of state, we've been able to get, one time, a 30-day override with some insurance companies. So again, ask us and we will certainly try. But because of the cost of the medications, often insurance companies won't switch to a 90-day supply.
And some people have used mail order pharmacies in this time period as well, to get to get over the obstacle of maybe getting to the pharmacy, and unless there's a drive-through, because in the early days of the pandemic, it would be nerve-wracking to try to enter a pharmacy or before everyone was masking, or before we even knew that you had to mask, but there's ways around things. And like Dr. Garland said before, most of us now in this in the HIV care world tend to treat us like your patient-centered medical home, and call us for just about anything. And I tell patients all the time, if I didn't know, I couldn't help you, but so whether it's rides or food or housing or other ways that we can assist, just reminding people that we are here, and we may have resources to help. And I think MAT has been great over the telephone, and we've had no obstacles with Hep C treatment. We've had no issues with the prior authorizations and medicines. People have completed treatments while the pandemic has gone on. So I'm sure you must have felt the same, Dr. Garland. There's really been no obstacle there. So people should continue to reach out to their providers if they're having any of those issues. Our behavioral health department has been at 140% productivity. They've, just outdone themselves as to how much support they've provided our patients through this pandemic. It's just, I admire them for that. Yeah.
So yeah, we've been really impressed by how many clients keep their appointments.
Mm-hmm. When they're homebound. Yes, that's true. And everyone's so happy to hear from you. I'm so happy to talk to patients over the phone when they're so kind of de-stressed in their home environment. It's just really refreshing. I've loved every bit of telehealth. I don't know if what I'll do when it's no longer an option. I think I'd love to connect with people when they are in their comfort zone. Yeah.
I noticed there was a question about 12-step meetings. Our meeting, actually, that I mentioned earlier on Wednesdays on Zoom at noon is an all recovery meeting, simply because we have only the one meeting. So we want to make sure that it's accessible to everyone. But if people are looking for a 12-step meeting, I know the Anchor Recovery Center is offering them. And then also, if you go online and just Google AA online, you're going to find that there are lots of groups. We've had a lot of people in our recovery community come back to us and say that the online recovery community is thriving at this time. So they've been able to come together and support one another in that way. So it should be relatively easy to find.
I wanted to mention one last thing too, because I know we were in reference to talking about new sexual partners during this time. We can make free condoms and safer sex supplies available to people as well, as I'm sure other agencies can, whether that's picking up, in the parking lot or possibly mailing. So always feel free to contact us, and probably, I'm sure, ACOS or Weber Renew as well, if you need those things.
Okay. My clock is saying 8 p.m. right now. It's certainly a learning curve for all of us. But thank you all so much for your wealth of information and all of the and it's providing all the services that you do. If there is anything else that anybody would like to say in the last minute, please feel free to do so right now. Otherwise, we will be wrapping this up very shortly.
So again, I just want to thank everybody. First of all, thank Doug for your great job at facilitation. I apologize for a few little glitches that we encountered along the way. I apologize to Ashley that for whatever reason we weren't able to get her on board. And also, again, thank you to all the presenters. And we will have this available, all of the agencies, we can send a link or a copy of this. So this could be available to other individuals who weren't able to log into this tonight. So again, thank you everyone. And we are hoping that this will be the first of a number of sessions that we can offer our patients and clients, just to be more supportive of their needs and where they're at in dealing with this COVID epidemic. So thank you again.
Thank you all very much.
No, thanks everybody. Stay safe.
Good night.
All right, have a great night, everybody.
Be safe.
Take care.